Hi guys, welcome back to UWorld's Live and Learn. I'm glad y'all are back here with us today. We're going to take a moment and let everyone log on to their streaming devices per usual. We appreciate y'all joining us today. We're streaming on multiple streaming services. So we're on YouTube, TikTok, Facebook, and Instagram. So we know that TikTok sometimes has trouble viewing the questions, so we have something new today, so let us know how you like that. For today's topic, I brought some props with me. I've got some marshmallows and some skewers. And no, we're not making s'mores. That would be very fun, but I don't think I could do a bonfire inside. That wouldn't be very good. So if you can guess what we're doing, go ahead. But speaking about snacks and studying, let us know in the chat while we're waiting for our friends to log on, what kind of snacks do y'all like to enjoy when y'all are studying? When y'all are doing those UWorld questions, what do y'all like to snack on? I know my favorite snacks when I was studying were like stuff that was easy to grab, like anything like Chipwise or like little candies and stuff, and things to bring and share with the study group. That was always a good time. Yeah. And then also hydrate while you're studying. That's a really big one. Make sure, I know that nurses always have that stigma of carrying around their water jugs. I am a culprit myself. I got to admit to that, but it's so important. Your body will thank you not only while you're studying in school, but also when you're in the future in your clinical practice. So make sure you hydrate and eat those snacks and give yourself some nutrients. Okay, I think we're ready to go. Sounds good. Okay, so welcome back. If you didn't get to meet me on Tuesday, my name is Valerie. I'm a registered nurse here at UWorld on the nursing education team. My clinical background is in neuroscience and neurosurgical critical care. And I'm very excited to be here with y'all today to talk about multiple sclerosis. Just to go back to snacks, if you didn't log on in time, we were talking about snacks and studying. My favorite way to use UWorld when I was in school and studying for my NCLEX when I graduated was to use snacks as a reward when I was doing UWorld questions. So I would study, you can choose a certain amount of questions to your sets, maybe do 15, 10 questions, and then if I got a certain amount right, take a snack or take a treat. It just to reward myself. It just made studying way more fun. And I'm hoping today that we can make multiple sclerosis a little bit more of a fun topic to learn than it might be sitting at a desk, okay? So today we're going to talk about multiple sclerosis. We'll start with the question. We'll break it down starting with the question, and then we'll go into what multiple sclerosis is. We'll talk through it, how it presents in our clients, how it can be diagnosed, and then how it's treated and managed, okay? Throughout our live today, make sure to leave comments or questions in the chat so that we can help you and make sure that y'all are getting the most out of this while we're here, okay? Okay, let's go ahead and get started. Our question today is, the nurse is talking with the client with suspected multiple sclerosis. Which of the following findings would support a diagnosis of multiple sclerosis? Option 1 is pruritus. Option 2, shuffling gait. Option 3, muscle spasticity. Option 4, unilateral muscle weakness. I'm going to repeat the question one more time. The nurse is talking with the client with suspected multiple sclerosis. Which of the following findings would support a diagnosis of multiple sclerosis? Okay, option 1, pruritus. Option 2, shuffling gait. Option 3, muscle spasticity. Option 4, unilateral muscle weakness. Okay, so let's break down this first part of the question. We know we're talking with someone that we're pretty sure has multiple sclerosis. And the second part of the question, we know that we're looking for manifestations or findings that are true for multiple sclerosis. So if I were taking my NCLEX, and what I would do when I was a student, I like to do the whole underlining and circling keywords here. So following findings, I would circle that, underline that, and then the multiple sclerosis. Those are my keywords here. Findings, multiple sclerosis. That's what I'm focused on. So let's jump into that. So multiple sclerosis is a chronic and progressive degenerative disorder of the central nervous system. Onset is typically between 20 and 40 years old. And it can be either genetic or environmental factors that bring it on. Now, this is where I want to use my props here to kind of explain what multiple sclerosis is and how it happens in the body, okay? So bear with me here. I know it might seem silly, but just bear with me. So I have here, so normally in the body, we have our neurons. So we have kind of like the skewer in this situation is going to be an axon. So we have the axon, and then the marshmallows here are going to be our myelin sheath. So we have a neuron and a myelin sheath, okay? And then I'm gonna set this down. And in this case, we have our B and T cells, okay? So in this scenario, this is mirrored, so bear with me here, is that this is going to be a T cell, and this is going to be a B cell, okay? T cell, B cell. Okay, so multiple sclerosis is typically thought to be an autoimmune disorder, but that's just because it's it's immune mediated. What that means is that it starts as a inflammatory process, and then when that inflammatory process occurs, so the inflammatory process occurs, and then it progresses. It's 3 phases. So inflammation, demyelination, and then gliosis. So you have the inflammation, it kind of overreacts, and then it attacks the myelin sheath, and then that turns into scar tissue, and that's that 3rd process, okay? But let's break that down further so we can understand fully. So we have our neurons here. So normally, the B and T cells cross the blood-brain barrier to kind of, they're like security, and they go in and they check for any antigens, and they just protect. So they go in and they make sure, and in multiple sclerosis, the T cells overreact. They kind of act out in a sense, and they believe that the myelin sheath are bad guys per se. So we're gonna get rid of the B cells in this situation because they're not overreacting. And then we have our axon with our myelin sheath. So the T cells attack the myelin protein on the myelin sheath, and then they start destroying our myelin sheath. And then you get all of this ruined myelin sheath. Oops, making a mess here. I don't know if we can kind of see that demonstration there, okay? And then I have a prettier one to kind of reference back to, okay? So when you have nerve impulses, they kind of bounce, right, through the parts that are not covered with myelin sheath. That's the whole point, is that it's for nerve conduction. So they bounce really fast through the spaces here. When you have a nerve that looks like this, where the myelin sheath is now destructed from T cells that overreacted in an immune-mediated response, your response kind of goes like this, and it skips, and it's slowed. You have a slowed nerve response now because you have all these gaps and openings that's caused because the myelin sheath damage, okay? And then while we're here, we might as well snack a little bit. There's nothing wrong with that, okay? You gotta have fun while you're learning, right? Okay. I hope that makes sense to people. So that's the inflammatory response, and then the demyelination part. So let's talk about the gliosis part. That's where the axon gets damaged. So when you have the myelin sheath damaged and you have all these pieces missing like this, scar tissue can build up and plaque can build up. When this happens, the axon can get damaged, and it can lead to paralysis and permanent nerve damage. So for presentation purposes, we're going to kind of break that and just kind of show you how that would kind of be what plaque can do to the axon if that builds up in multiple sclerosis. And that would be a severe case of like paralysis, okay, in multiple sclerosis. I hope that was helpful. Okay, so going from there, let's look at manifestations. We kind of talked about the extreme with paralysis and everything, but that's, like I said, pretty severe and extreme. So when we have that neuron where it's pretty spotty, multiple sclerosis doesn't necessarily, well, actually, question for you all. What systems of the body do you think can be affected by multiple sclerosis? Such as like musculoskeletal, cardiovascular, or gastrointestinal. I'm ask it one more time. What systems of the body can be affected by multiple sclerosis? Okay. Remember, it can have spotty distribution, so it doesn't really like pick and choose where it wants to go. Unfortunately, you don't get to just kind of decide. But let's see here. I'll give you all a moment. Okay. Okay, so whenever you have these kind of nerves throughout your entire body, right? So with multiple sclerosis, any of them can really be affected. The big ones we're going to see, and we'll break these down later, are going to be musculoskeletal, gastrointestinal, reproductive, urinary, and nervous system are some big ones. We don't typically see signs of cardiovascular, although multiple sclerosis can have complications that then lead to respiratory and cardiovascular disorders, if that makes sense. And we'll break this down, okay? So you have this spotty distribution of myelin sheath damage throughout your body. It doesn't get to pick and choose. Deterioration can be rapid, typically. People can have remissions or exacerbations. And treatment is often not sought quickly because clients who have this don't know that they have multiple sclerosis. So they kind of delay because they don't really know what's going on. So by the time they get treatment, it's been occurring for a while. So vision changes, we'll start there. It can be blurred, double vision, color distortion, or blindness in one eye, muscle weakness, balance problems, all from that nerve damage, partial or complete paralysis, numbness or tingling, muscle spasticity, or fatigue, speech problems like aphasia, swallowing problems like dysphagia, urinary incontinence, and hearing loss. So the thing with when the plaque buildup happens is it builds up on your cerebral cortex in your brain. It's that top layer. It can build up in certain spots. And the funny thing with the brain, kind of like how we mentioned on Tuesday, is that everyone's brain can be different. It uses certain different spots, kind of. So depending on where your plaque builds up affects what manifestations you show. So if the plaque builds up in a spot where urinary system is affected, you might have urinary incontinence, if that makes sense. So that's why there's just this wide variety of manifestations that you can have during multiple sclerosis. But big ones are muscle weakness, muscle spasticity, the feelings of paralysis and stuff like that. Two known, this might be multiple sclerosis symptoms are going to be that electric shock with neck flexion and pain around your low thoracic spine and abdominal region and that's from the intercostal and abdominal muscle spasm. I think they also call it a multiple sclerosis hug. I think that's the more street term for it. Okay, so let's talk about how this can be diagnosed, okay, and how it can be determined that clients have multiple sclerosis. So question for everyone. Do y'all know how multiple sclerosis is diagnosed? Ask it one more time. Do y'all know how multiple sclerosis is diagnosed? Okay. And I know this isn't something that we typically, we aren't going to diagnose multiple sclerosis. And the only reason I'm kind of touching on this is just because it might be nice if you are in the clinical setting to prepare for this for your client and kind of expect it for your next steps if they're expecting a multiple sclerosis diagnosis, if that makes sense. Okay, so let's go into this. I see some we don't know, and that's okay. So two ways we can do this. One's an MRI. An MRI is going to show us if we have any damage or any inflammation throughout the central nervous system. And then the second way is taking a CSF sample or cerebral spinal fluid sample. That'll show us, they'll test certain cell samples in the fluid and see if it's having an inflammatory response. And that's that. Okay, so how is MS treated? So, MS as in multiple sclerosis. It can be treated with immunomodulator drugs, such as interferon. It's a hard word for me to pronounce. IV steroids can be used to treat exacerbations, another hard word for me to pronounce, so pardon me. And then lots of medications and therapies can be used for symptom management. The immunomodulator drugs and IV steroids, immunomodulator drugs are used to help kind of reverse that immune-mediated response, while the IV steroids are more so used to treat the inflammatory response. And then we're going to go into this next kind of area of treatment, and that's going to be medications and therapies for symptom management. So, another question for y'all. How can multiple sclerosis patients manage muscle spasticity? And here's the hint. It's a type of medication inserted into the body. I know that sounds a little funky, but I don't want to give it away. So how can multiple sclerosis patients manage muscle spasticity? And while we're waiting, I do see someone said plasmapheresis. I'm not too sure with plasmapheresis if I know myasthenia gravis, they do plasmapheresis. But off the top of my head, I don't think they typically use plasmapheresis for multiple sclerosis, but I could be mistaken. Immunoglobulin is, I think, one of those kind of like immunomodulator forms. Okay, so going back to how can multiple sclerosis patients manage muscle spasticity. So I gave you the hint of its type of medication inserted in the body. This was kind of tricky. What I was getting at was it's through an intrathecal pump, and that's baclofen. So that is a muscle relaxer. It's the kind of that pump that gets inserted into the spinal cord, and it kind of sits in your abdomen. So that's how we manage symptoms here. So we can manage muscle spasticity this way through muscle relaxers, manage pain through pain medication. You can manage other like muscle weakness through physical therapy. Botox injections was another one that you can give for pain regimen. Daily exercise is also highly recommended just to help keep them, like as a preventative, to help stay away from having exacerbations. I should just stop saying the word if it's so hard to say for me, right? Ugh. Okay. So moving on to nursing management. What can we do as nurses? So we can help educate the client to avoid triggers. Some major triggers for clients with multiple sclerosis are becoming overheated. Becoming overheated is known to trigger fatigue, the fatigue manifestation in clients with multiple sclerosis. And then we want to educate them to stay away from infection and stress. Okay. And then we want to also prevent them. So we have clients in the hospital and they're immobile from multiple sclerosis, big things we want to do is prevent further breakdown from being immobile. So what we can do is prevent pressure injuries and UTI just from frequent mobilization, like turning and mobilizing in bed if they're not able to get up, or working with our interdisciplinary team to see how we can best support those clients. Okay, and another big one is just providing emotional support. And I know this one isn't really taught super well in school, but it's something that you'll gather just through experience when you start practicing in the clinical setting. It's just these patients are going through a lot, and it usually comes on quite suddenly, and it's a new diagnosis, so that emotional support is key, okay? Okay, so now that we've talked through, preventing falls, that's a big one. Great job, yeah. Safety is always a priority, absolutely. So now that we've talked through multiple sclerosis, let's go back to the question. So the question is, the nurse is talking with the client with suspected multiple sclerosis. Which of the following findings would support a diagnosis of multiple sclerosis? Option 1 is pruritus. This one is incorrect. Clients with multiple sclerosis, they might have numbness and tingling, like we mentioned earlier, but they won't have any like itchiness or necessarily rashes on their skin. Option 2 is shuffling gait. This is a more common manifestation in Parkinson's. A client with multiple sclerosis might have coordination issues or muscle weakness. Option 3, muscle spasticity. This one is correct, like we mentioned, because of the way the axon and the myelin sheath is broken down on that axon, the nerve impulses can jump, and it can just kind of, also on the spinal cord where that, all that kind of nerve bundle is, it can cause the reflexes to go all wonky and muscle hypertonicity to happen. So that's why muscle spasticity happens. And option 4 is unilateral muscle weakness. Unilateral weakness is most often seen in a stroke. In a multiple sclerosis client, we wouldn't see them necessarily having a bilateral or anything that's follows a pattern per se, because it is that kind of spottiness through the way the myelin sheath breaks down throughout the body. Okay, so today our answer is option 3. Okay, if you have any questions or any need further clarification, leave them in the chat. And if we can't get to it today, we'll try to get to it on our next live and learn, which will be next week. And Jackie should be back next week for that. But great job today, everyone. Y'all did awesome. Y'all did amazing. I hoped y'all liked the props today and it wasn't too much. I hope y'all understood and it helped give a visual for those visual learners out there. Feel free to share what you've learned today with your colleagues and share your favorite snacks. That's always a way to get a bigger study group and better study buddies for the NCLEX. And share your favorite parts of UWorld with them. We have that free 7-day trial on our website for PNs and RNs. It kind of gives you a taste for practice questions and the study tools that are available on there. And I really appreciate y'all joining us today. Thank you so much, and we'll see y'all next time. Y'all have a good